I would say that so far there are medications for alcoholism, there are medications for opiate dependence, there is nothing for cocaine or stimulants such as methamphetamine. There is something for benzodiazepines such as Xanax or Ativan or what have you. Marijuana, for example, is, well, there is no really dependency on marijuana, but there is abuse. People do abuse marijuana. And so far, there's really no treatment for that, medication-wise. We're talking about medications. We talked about the treatment of alcoholism with, for example, you detox in the hospital with, we detox them with agents, detoxing agents such as benzodiazepines. Temporarily, we detox them, and then we put them on medications for alcoholism such as Camprel or naltrexone. There's also anti-abuse that we can, disulfiram, which is also an option for people who just can't stop drinking. But we usually give it to the family member to give it to the patient every morning so the patient doesn't drink. Because if they do drink, they get really, really sick and they might even die. So that's about alcoholism. Now, in regard to opiate addiction, we mentioned Suboxone. I don't think we spoke on methadone, but methadone is also another option. The problem with methadone is that you have to go to a methadone clinic every morning, like 5 or 6 o'clock in the morning, and it's a hassle, and it can be abused. Not, in my experience, I find Suboxone to be much more efficacious and more convenient for patients. What else? We also mentioned the Vivitrol for opiate dependence. That's another option. In regard to the other drugs, benzodiazepine, such as Xanax, for example, which is a highly addictive drug, mostly prescribed by physicians, not necessarily psychiatrists, though. I think psychiatrists know a little bit better. They know better than doing that, but you know, usually family practitioners and other practitioners, they do prescribe a lot of Xanax, which is really I mean, personally, I think Xanax should belong to the museum with the dinosaurs, but it's still used. So we detox a lot of people from medications such as Xanax. And how do we do that? Well, we use different techniques. We can use long-acting benzodiazepines or phenobarbital in the hospital. And after that, we put them on mood stabilizing agents or mood stabilizers for a month or two. And again, like I mentioned before, addiction is really a manifestation of an underlying issue, underlying illness, underlying something. So we have to treat that too. Benefits. Well, the benefits from these medications, well, of course, there's a lot of benefits. You know, first you get off the drugs, such as alcohol, opiate, whatever, benzodiazepines, and after that you have to go to a rehab. I recommend at least 1 month rehab after you get detox from the drug. So the benefit is actually you don't have to suffer and you don't have to have seizures. That's another thing, you know, because if you stop alcohol suddenly and you're a heavy alcoholic, for example, you can have a seizure. So to prevent that, we give you these medications. So there's a big benefit. People might die from seizures or DTs. DTs is delirium tremens, which is one of the manifestation of stopping alcohol suddenly without treatment. We have to give you also vitamin shots such as thiamine, which is vitamin B1 IM, and we have to give you that for a few days when you get admitted to the hospital. So there's a lot of benefits from getting the help in the hospital to get detox from drugs, because we give you something so you don't withdraw, and at the same time you don't have seizure or something that is fatal, which can happen especially from alcohol, barbiturate, or benzodiazepine. So those three drugs of addiction, alcohol, barbiturate, and benzodiazepine, they can kill the patient if they stop them without treatment with medications. So that's why we actually treat, because you don't want to kill the patient, and you don't want them to have also miserable withdrawal symptoms, because they're going to go use again. And that's the whole, by the way, that's the whole philosophy behind methadone or Suboxone, because people always say, what's the point of getting off OxyContin and being on Suboxone? They're both addictive. Well, hold your horses. It's not as easy as you think. It's really, it's not like that, because when you are on methadone or Suboxone, for example, you can function. You can go to work, you can function, and eventually you can get off of them, and you should get off of them, of course. You should. Nobody should be on maintenance for years and years and years.